the state health officer in Oregon.
And my name is Bukosi Dube. I'm a senior health advisor with the Oregon Health Authority. I'm also a public health physician. Today we'll be talking to you about how to safely practice the holidays under these very unusual conditions.
So before we get into more data about COVID, I want to talk a little bit about the logistics for today's events. As many of you know, the Oregon Health Authority recommends when indoors with people who are not members of your households, you should wear a face covering. However, today, we are taking off our face coverings when speaking so we can communicate with people who do not speak sign language and depend on seeing a speaker's mouth and lips. The speakers are 6 feet apart. Our ASL interpreters are 6 feet from the speakers and 7 feet apart from each other. We have also recently upgraded the air filtration system in the building, and we have limited the number of people who are physically in the room to the minimum number possible. What we know is that COVID is surging throughout Oregon. Just a couple of days ago, we reached 75,000 cases. Just to give you some idea of how fast that happened, it took us 6 months to reach 25,000 cases in Oregon. 6 weeks later, we passed 50,000 cases, and that was on November 8th. 3 weeks later, we surpassed 75,000 cases. The virus is widespread, and it's dangerous.
Caseloads have spiked after nearly every holiday since Oregon reopened. We simply cannot celebrate this year like we have in the past. If we keep our gatherings small, ideally to people within our households, then we may have a chance to turn back this rising tide. We have noticed that the feedback that we've gotten from our social media team regarding the Thanksgiving holiday has been very positive, especially regarding how people adjusted their plans on how to celebrate that the Thanksgiving holiday to ensure that they do not have more than 6 people gathered. So thank you to people who made those adjustments, and thank you for giving us the feedback. The skyrocketing case counts we're experiencing have potentially dire consequences. We're also seeing severely ill COVID-19 patients filling our hospital beds at an alarming rate, the highest numbers since the pandemic began. Hospitalizations due to COVID-19 have tripled since October 26th. Unless we get the virus under control, we face the threat of overloading our hospitals with severely ill patients, putting our lives at risk. Hopefully, today we can give you some ideas about how to enjoy the holidays without getting ourselves or others sick.
I love this time of year, reaching out and connecting with family and loved ones. But this year, my family decided not to travel. We live with an older relative, my mother-in-law, and we decided to keep our celebrations small and local. I like to think of it this way. The sacrifices we made this year at Thanksgiving and will make over the upcoming holidays will ensure that we can safely celebrate the holiday next year in person with our family and loved ones. The good news is that a reliable vaccine is on the horizon, and that's going to help us get there. But until that vaccine is approved and available in Oregon, we know it's going to be several months before people are vaccinated, and we have to continue some basic COVID-19 safety measures. So stay home if you're sick. Wear a mask or a face covering when you're outside of your house. Keep your gatherings small, even on the holidays. Try to avoid travel as much as possible. Maintain your physical distance from others. Wash your hands frequently. And let me add one more thing. While you can't get a COVID shot now, you can get your flu shot.
Thank you, Dean, for pointing that out. We're encouraging all primary care physicians to have their patients get a flu shot as soon as possible. We know that these changes to our celebrations can be particularly hard for families with kids. Here are some suggestions from the American Academy of Pediatrics. Spend a few moments each day enjoying the company of your children at this holiday. It can bring your family closer and boost your mood. Try using extra downtime to do these things together as a family. Some of these things include using your talents to help others. Go out there and volunteer, give back to the community as much as you can. Talking about your family's culture and heritage and values can be a good way to get together and foster good bonding. Cook together, for example. Making your favorite family recipes. Finding ways to play and laugh together. Board games are a good way to bond. Consider making special cloth face coverings to wear during the holidays. Aim to be present in the moment. Teach your kids to use mindfulness and relaxation to cut down on stress. Practicing gratitude as a family can also help you appreciate what's going on right now, and also remind people how lucky we are to be alive during this time period. Please also know that it's okay and perfectly acceptable not to feel okay right now. If your kids are struggling with the changes around the holidays, and you're not sure what to say, one of the best ways and best things you can do is simply listen.
Thanks, Rukosi. We also want you to know that help is available if you're struggling. You can find health resources on OHA's Safe and Strong page at safestrongoregon.org. You can also call the Safe and Strong helpline. That number is 800-923-4357 or 800-923-HELP. The line offers free 24/7 emotional support and resource referral to anyone who needs it, not only to those experiencing a mental health crisis. But now we're ready for your questions, and we want to make sure we can get to as many questions about the holidays and social gatherings, so we won't be taking questions on other topics. We're going to prioritize our holiday questions.
The first question is from James. If no more than 6 people can gather total, what are households with more than 6 people supposed to do? That's a very good question, and thank you for that question, James. So this would mean that the ideal thing to do would be to just limit the gathering to those within that household, so that you do not exceed, you do not have more than the recommended gathering limit.
Gail asks, why is shopping with lots of people at big box stores like Costco, Walmart, or others safe, but gathering with a small group of friends isn't? I think let's talk about the encounters a little bit. When we're in a retail store, certainly if the store is crowded and you feel uncomfortable, consider going at another time when there are less people there. But when we're in the store, we are typically moving around and not in contact with the same people for very long. We also typically don't spend a significant amount of time there. When we get together with our friends and family, often we let our guard down. We spend more time together, closer than we should. We're often drinking or eating, and we take our masks off, and all of those things put us at higher risk. So right now, shopping is a fairly safe activity. Try to go when the stores are less crowded, limit the amount of time you have in there, bring a list if you can, and that's a way to lower your risk when you're shopping.
We have another good question from Tiffany. What do you recommend for visiting COVID patients in the hospital? So most hospital systems have guidelines as to what to do when you come and visit patients in the hospital. The ideal thing would be, having been a hospitalist, I can tell you that being in the hospital can be very, very lonely for a lot of patients. And getting visitors can be very good for their mood. During this difficult time, however, we recommend that we limit the number of people visiting hospitals so that we do not bring in the virus to to other people in the hospital, to employees at the hospital, and other people we may encounter at the hospital. And also follow the guidelines from the hospitals regarding how to stay safe while you're visiting your loved ones in the hospital. Most hospital systems have a limit of 2 persons per, 2 visitors per patient. I would recommend that everyone takes heed of that and follows that.
Before we get to our next question, I want to add a few things to that. While it can't replace being there in person, using the phone or video calls can be a way to keep in touch with folks. And while this is about hospitals, let me address the issue of our friends, family, and loved ones who may be in long-term care facilities or skilled nursing facilities. We know that not just the holidays, but this whole pandemic has been very hard on them. We've seen some of the most serious illnesses come out of residents in these facilities, with over half our deaths from these facilities, and we've had to limit visits to these facilities because of that. That can be very hard on the residents, their families and loved ones on the outside. So again, as cases have increased and we've had to tighten up on visiting restrictions in those settings, I encourage you to use other means, the phone, video calls to keep in touch, send in their favorite food or other gifts, visit through the window, visit outside when it's available. Those are ways to keep your loved one and yourself safe so that when we go back to visiting, we can all do that safely. So now I want to go to a question from Wendy. If I get a COVID test the day before visiting my family and it's negative, am I safe to visit them? And the answer there is, we don't know. You might be. What a COVID test tells us is whether or not a person has an infection at that time. If the test is positive, it's very likely that person has COVID. But if that test is negative, there's still a good chance, perhaps up to 30%, that that person may still have, you may still have COVID and have tested negative. So the best way to reduce your risk when visiting family or in visiting friends is to limit your activities before that visit. So to quarantine or self-isolate at home and limit your trips out of the house for at least 10 days before that visit. By lowering your risk for getting COVID, you can thus lower the risk of giving it to others. The test may provide some reassurance if it's negative, but it doesn't mean you don't have COVID and doesn't mean you can't follow the rules.
We have a follow-up question from Claire. If I travel to visit family over the holidays, do I have to quarantine when I get back? So what we're recommending at present is that ideally do not avoid traveling so as not to spread the virus. If you do have a travel, when you get back, the ideal thing would be to quarantine. And right now we're saying for 14 days.
Some of you may have heard that the CDC just lowered their quarantine limit to 10 days, and Oregon is in the process of looking at that. But again, according to the Western States travel guidance, if you've traveled out of state, you should be quarantining at home when you return. If you visited other relatives who aren't typically in your bubble, you should be quarantining at home and limiting your activities. That's the best way to keep other people safe in case you got sick while you were gone. So now John asked, is the 6-person, 2-household limit even enforceable? The 6-person limit and the increased sizes and the risk levels with less cases are enforceable per the governor's executive order. The recommendation is to limit that size of the gathering, and the requirement is to limit the size of the gathering, and the recommendation is to limit it across households. So going over the total number in those gathering limits is a misdemeanor. But what we hope is that people take these seriously, protect themselves and the people they're with to limit the spread of COVID. The 2-household limit is there to really kind of think about the risk you're taking over time. At that one instance, you may be getting together with 6 people from 2 different households. But who have those friends and families been with in the time before your visit? How likely is it that they may have been exposed to COVID and don't have symptoms yet, but are sick and could give it to you. So think about the people you get together with over time, limit that as a whole, and know that we're not going to be out there counting the number of people who come into your living room, but certainly those gathering size limits are enforceable under the governor's executive order. I will say we had another question there about enforceability and kind of single person households. And what does that mean? Does that mean I can only get together with one other person? And I would say those numbers on household get-togethers, the people in the social gathering, are the piece that's enforceable. And the recommendation is to keep those limits in those counties with the most spread to 2. Certainly, if you're a single person and have 2 other single friends and the 3 of you get together, that meets the required piece of the executive order. It goes over the household limit, and we would recommend you don't do that because it can increase your risk. But really try to limit your gatherings as much as possible over time. Use technology and other means to stay in touch. The actions we're taking now are not forever. These actions are for now, so that next holiday season, when a vaccine is available, and most of us have gotten it, can look much different than this year. So the sacrifices we're making are real, but they're very important, and they're going to help us get through this and celebrate differently in 2021.
Cindy asks, what happens if more than 6 people live in a household? Does someone have to leave? Certainly not. You are considered to be part of the same bubble if there are more than 6 people, so no one has to leave. You can enjoy your time together, but would recommend that you do not invite people outside of the more than 6 person household.
And so Sarah had asked a question about if I get together with a couple of friends. If I live alone and get together with a couple of friends from different households, should I only get together with one of them? I think I touched on this earlier. I think the goal is to really look at the risks you're taking, who you're getting together with over time, and try and limit that as much as possible. Choose a small group of friends and family that you're getting together with regularly. Limit your visits to them and use other means to stay in touch with your broader social circle. Again, this is, just for now, not forever. And this Christmas, this Hanukkah, Kwanzaa, New Year's, we hope will look much different next year. The same way Thanksgiving and the sacrifices that many of you already told us you made over Thanksgiving will pay off so that we can get through this winter and spring until the vaccine arrives, and we can celebrate holidays much differently in the future.
Kupi asks, will the state close again for the upcoming holidays? Ideally, well, if the numbers continue to rise, we may have to have some limitations to ensure that we slow the spread of the virus. As you may know, we have come up with a risk stratification system that is starting today, and counties have different risk stratifications that limit the number of people gathering together, what businesses may be open, what activities may occur, and I'll let Dr. Seidlinger talk more about that, since he has been involved more than I.
Thank you. The freeze in Oregon across the state ended yesterday. And today, each county is in a different kind of risk level based on the number of cases, the spread of COVID-19 in their county over the last 2 weeks. Unfortunately, what we've seen is that most counties, I think 25, have some of the highest spread we've seen in Oregon since the beginning of the pandemic. So they would be in the category with the most restrictions of extreme risk. This looks very similar to the freeze, but based on conversations and looking at data, there are a few additional activities that are being allowed. A limited amount of outdoor dining with some safety precautions in place, an increase in the gathering sizes for some of our faith-based institutions. We have lowered slightly the capacity limits on retail to try and prevent crowding, but otherwise there's some level of activities allowed even in those counties in extreme risk. But we ask each of you to kind of heed the warnings and take that guidance seriously. Try and limit your time when you're around others outside of your home. Try and limit the activities that put you indoors with crowds of other people. Try and move activities outside as much as possible. Always have your mask on, and really change the behavior and the way you get together with your friends and family this holiday season. This is a sacrifice, and a very large sacrifice, but it's one that won't last forever.
Jillian asks, what is your recommendation on getting tested? So there are guidelines that we've put out, the OHA has put out, and that CDC have put out with regards to who should get tested. This is also a decision that is made by a clinician as to whether or not to order a test. What we recommend is that people who have symptoms should get tested, and those who have come into contact with someone who has tested positive and developed symptoms should get tested. The best thing you can do is make sure that you follow the COVID protective behaviors, and if you develop any symptoms, contact your primary care doctor to see if you need to be tested.
A question came in from Chris. What if a person tested positive now? Would they be safe to be around at Christmas time? That's a difficult question to answer, Chris. I think what we know from people who test positive for the virus is that they are most contagious in the period before they get symptoms for 2 days and in the 5 days after they develop symptoms. So the recommendation is for that individual, if they have symptoms, that they stay home and isolate for at least 10 days or until their fever is gone and their symptoms are resolving, whichever is longer, that period of 24 hours without a fever or 10 days, whichever is longer. Certainly, they could still shed some virus after that, but it's very unlikely. So we would recommend that people still continue the same precautions, that they limit their contact with others, even when they come out of isolation, that they wear a mask when they're around others, but they're likely not at their most contagious point by Christmas. I want to follow up with the next question that came in instead of handing over to Bikosi, because this is one I've been answering a lot. But Brandy asked, why can I go Christmas shopping where I'm touching shelves that everyone else has touched, but not to the gym where everything's wiped down between uses? So let me talk a little bit about what we know about the spread of the virus. We know that the virus is transmitted primarily through droplets. So when we cough or sneeze, or even when we talk, these droplets can come out. They typically don't go more than 6 feet, which is where our recommendations for keeping 6 feet apart come from. But we also know that there are even smaller droplets that can travel further. The masks and face coverings that we wear help protect from these. Being outside and limiting the amount of time we're around individuals also helps to protect those around you. Those droplets can land on surfaces, and yes, it is possible to touch a surface and then touch your mouth, your nose, your eyes, and get infected. And that's why it's really important to use hand sanitizer or wash your hands thoroughly more frequently. So you can touch something that even has those droplets on it. And as long as you're not touching your face and you wash your hands, you're not going to get infected. It doesn't come in through the skin. The reason there are more restrictions on gyms is when we go to the gym and work out, we often breathe heavier. That's one of the reasons we go there, to get exercise and work our hearts and work our bodies. As we breathe heavier, you can pass the virus further from that heavy breathing. Also, when you're working out, if your mask gets damp from sweating, the mask is less effective at preventing the spread of the disease to those around you. And that's why in the counties with the most highest level of cases and the most extreme risk, that we recommend that outdoor gym and fitness classes occur, but those indoor activities wait until the case rates have come down. So that's kind of some of the differences between being in a store and being in the gym.
Jennifer asks, what's the plan to address individuals who blatantly disregard safety? So this is a very important question because it hits at one of the most important things that we've repeatedly tried to emphasize. We're in this together, and we have to ensure that we practice COVID protective behaviors as a society so that we do not spread the virus to those to others. And there are those among us who are more vulnerable than the rest of the population, and we've seen that they've bore the brunt of this virus. In certain situations, people may not be allowed to come into work because of blatantly disregarding safety. As many of you have heard, there was a recent health hospital that had to put someone on administrative leave due to social media posts boasting about not wearing face masks or practicing good hand hygiene and ensuring that their family members are not going out and I think it was their kids. They were allowing their kids to go out and on play dates. So we're in this together. Let's fight this disease together and ensure that we're not spreading it. Dean, any thoughts or comments?
No, this can be difficult, Jennifer. I think, if it's a relative of yours or a family who's blatantly, not following the rules, and you have a relationship that you can talk with them, that would be great. But the idea of changing social norms, I think, is very important. So let's think back 30 or 40 years ago. If someone lit up a cigarette at their desk in the office, no one would have thought anything of it. Now, we would really look at that person and likely go talk to them if they lit a cigarette in their office or in a restaurant. Things have changed, but things change even more quickly. Last Christmas, if you were at the mall shopping or your favorite local store and someone was wearing a mask, you might have looked at them and wondered, why are they sick? Should I keep my distance? But now, hopefully you go to the store and you say the same thing about the person who's not wearing the mask. Why aren't they wearing a mask? Why aren't they taking those steps to protect me? And you might go the other way. So it's really kind of changing those social norms, getting all of us to do the right thing, because it doesn't just protect ourselves and the people we go home to, it protects those that are around you. So wearing the mask and limiting gathering sizes is good for all of us, and we're in this together, as Bukosi said.
I really like the analogy of going back to smoking and highlighting how we changed norms to ensure that we're not exposing other people to harm.
Venice asked, what about mixed-use residential buildings with shared hallways and entrances where it's hard to avoid people? Should everyone be wearing a mask when we're in public areas of the building? That's an easy answer. Venice, the answer is yes. I think if you're leaving your unit, apartment, or condo, and you're in an area where you could come in contact with others in the building or others outside the building, you should have a mask on. So even if you're going down the hall to take out the trash, or you're going in to get to the elevator to go down to the garage, you should put your mask on in case you encounter someone else. It's a sign that you care about them. If they're wearing a mask, it's a sign they care about you, and it offers you protection as well.
There's a question from Daniel that I'd like to address, and this has to do with mental health. Daniel asks, what about mental health? Social isolation is destroying lives. I received a video today from a high schooler in Bend who, I think as part of their social studies class, had to make a video, and it was very well done in that they were highlighting the impacts of not being able to play sport has had on their community as a high school. We are very much aware of the mental health toll this virus has taken on our society, and we are mindful of, and we're very, very mindful of that. So when we craft guidance, we have we take this into consideration, and we encourage people to continue interacting with their friends and families via, as Dr. Seidlinger pointed out, video calls and the telephone, or even through glass, ensuring that we stay connected and ensuring that we maintain our humanity. I think as human beings, we're social beings. We long for that connection, and so we encourage people to continue practicing their socialness, so to speak.
I think just to add to that, I think, we know that the virus itself has caused illnesses in many people, and tragically, many deaths here in Oregon and across the country and the world. We know that people are scared and nervous about the virus. We know that some of the measures put in place are impacting people's mental health, and that's hard. If you have friends or relatives that you know are struggling, that are lonely, reach out to them, stay connected. If you need help, ask for it. Use the Safe and Strong website, call the phone number to get help. There are ways for you to stay connected to others, and ways that we'll get through this together. And now, since we're running out of time, we'll end with this last question from Maria. Should I report a large gathering if I see it, and if so, where? I would say, if there's a large gathering that's happening and you know the host, talk to them, ask them what they were planning, what's going on, remind them of the rules, so that they can limit the gathering at that point and not have that again in the future. If you have neighbors, folks in your community who are having a large gathering and it's disruptive, and you would have considered, having to put a stop to it before the pandemic, I would encourage you to do that as well. You can use law enforcement's non-emergency lines for that, but really think about, the gathering itself. If you have a relationship, try to provide some education. Try to ask people about following the rules and do it for each other. But certainly, if there's a larger gathering, particularly one that's disruptive, you can report it through non-emergency law enforcement numbers.
Thank you very much for tuning in, and happy holidays, everyone.
Happy holidays.